Bismillahirrahmanirrahim. Today we will talk about the rheumatoid arthritis in pregnancy. This is very hard topic for the examinations. So when a female patient with rheumatoid arthritis want to become pregnant, then there are certain advices which are required for the patient, and there are certain drugs which are safe in pregnancy, certain drugs which are contraindicated in pregnancy. So today we will talk about the rheumatoid arthritis in pregnancy in detail. So when a female patient want to become pregnant and she is newly diagnosed rheumatoid arthritis or their disease is uncontrolled, then the patient should be advised to postpone their pregnancy until their disease is controlled. Newly diagnosed rheumatoid arthritis or uncontrolled rheumatoid arthritis, patient should be advised to postpone pregnancy until their disease is controlled. Because in uncontrolled rheumatoid arthritis or newly diagnosed rheumatoid arthritis, this patient may need methotrexate or leplonamide, which are contraindicated in pregnancy. So first control their disease with the drug like methotrexate and leplonamide, and when the disease is controlled, then the patient can be shifted to safe DMARD like hydroxychloroquine, sulfasalazine, and if the patient want to become pregnant, then she can go. Number second thing is the safest analgesic in pregnancy is the paracetamol. Safest analgesic in pregnancy is the paracetamol. But paracetamol is not an anti-inflammatory drug, and in rheumatoid arthritis we need an anti-inflammatory drugs like NSAIDs. So about the NSAIDs. Davidson says that it can be given up to 20 weeks of pregnancy. Davidson says 20 weeks. While the past medicine book says it can be given up to 32 weeks of pregnancy. 32 weeks of pregnancy. And beyond this period, if NSAIDs are given, it will cause premature closure of the ductus arteriosus. Premature closure of ductus arteriosus. Now, what are the DMARD which are safe in pregnancy? This include the DMARD which are safe. This include the hydroxychloroquine and sulfasalazine. These are safe DMARDs like hydroxychloroquine and sulfasalazine. It is safe both in the pregnancy as well as in the breastfeeding. But if the rheumatoid arthritis are not controlling with the hydroxychloroquine and sulfasalazine in pregnancy, then there is another DMARD like azathioprine. This is also safe in pregnancy, but before starting azathioprine, you must do an enzyme test called the thiopurine methyltransferase. And if the patient is deficient of this enzyme, then azathioprine should be avoided because it will cause the bone marrow suppression. Azathioprine is safe in pregnancy but this drug is not safe in the breastfeeding. Not safe in breastfeeding. Now, azathioprine is safe in pregnancy but not safe in breastfeeding. Like hydroxychloroquine is safe in breastfeeding as well as in the pregnancy. Same is true for the sulfasalazine. Now, what about the methotrexate? Methotrexate is a teratogenic drug. It should be avoided in pregnancy. Contraindicated in pregnancy. If a female patient is on methotrexate and she wants to become pregnant, she should stop the methotrexate at least 3 months before the pregnancy. Stop the drugs at least 3 months before conception. Now, leplonamide. Leplonamide is also a contraindicated in pregnancy. Leplonamide. Contraindicated in pregnancy, and if the patient is on leplonamide and she wants to become pregnant, she should stop leplonamide at least 24 months before conception. Stop at least 24 months means 2 years. 2 years before conception. In methotrexate, in case of methotrexate, the main means male patient should also avoid pregnancy for at least 3 months. About biological demand, biological should be avoided in pregnancy. Biologic demand should be avoided in pregnancy. For rheumatoid flare in pregnancy, the drug of choice is steroid. For flare, you can use steroid. So this was a short video about the rheumatoid arthritis in pregnancy. The drugs which are safe in pregnancy are the hydroxychloroquine, sulfasalazine, and azathioprine. Hydroxychloroquine and sulfasalazine are safe both in the pregnancy as well as in the breastfeeding. Azathioprine is safe in the pregnancy, but it is not safe in the breastfeeding. Methotrexate is contraindicated and it should be avoided at least 3 months before the conception. Male patient should also avoid pregnancy for at least 3 months. Leplonamide is contraindicated in pregnancy and the patient should stop at least 24 months before the conception. Biological are contraindicated, and for rheumatoid flare, the patient can use the steroid in pregnancy. So these are the drugs which are safe in pregnancy and some of them are contraindicated in pregnancy. Thanks.